Thank you. Good afternoon. First, I would like to thank the organizers who have invited us here. Um, we hope we can do justice as discussants and reactants to this prestigious forum. And before I would like to congratulate all the presenters for educating all of us here. We need to learn. We are on the ground, but we need to learn more. Thank you for your ideas. And before I would go into discussing the presentations, my reactions, I'd like to show everybody a short video of what we have done so far in our local government unit, City of Mati.
Way para ma-ensure natin na ang security at health, ang healthiness ng inyong barangay, kaya nagbutang ng barangay isolation unit. But kung may moabot, automatic ibutang sa diha para ma-monitor ng ating health personnel. Amo, pwede pa mo magsuroy-suroy sa inyong barangay kaya walang exposure. So, pasalamat kong dako na dawat po ninyo ang inyong mga LSI. Ragaan po natin ay isipin ninyo kung moabot sa panahon na kayo ang nangangailangan ng isolation, ninyo gusto na ang komunidad ninyo ang mutalikod sa inyo, no? Ang community is like family. Magkahiusap ang tanan. Hangyo ko ngayon, ibutang itrabaho na ng gobyerno ang tanan para sa inyo. Ang kinahanglan na karon is ang disiplina. So saan ba magsugod ang disiplina? Dili galing sa mayor, dili galing sa kapitan, hindi sa sarili. Asang sarili. Kanya-kanya tayo disiplinahin natin. Wearing of mask. Kung madami kayong activity, face shield. Kung pwedeng likayan, ayan na lang paglabas ng bahay, balay lang mo. Kung lalabas kayo, pagbalik, pabor lang, maghugas ng kamay. Wash hands, mag-practice lang po ang social distancing. Anak kung atin ng disiplinado ang bawat Pilipino, kaya nating labanan itong COVID na pesting COVID na to. Kung ano pang darating sa ating pandemic. Basta may disiplina ang bawat isa. So yan lang po. Hindi ko natason kaya gusto na natin maabrihan ng pinto. Magsalita pa mo siguro dito at saka si George.
Good afternoon again. I think that will show what we have done in the past few months in our quest to fight the COVID war. And let me go right to the first presentation wherein it talks about the incident command system. I agree. I definitely agree because here in Mati, we didn't use any kind of agency in starting our war with COVID. We went directly into activating our incident command system as early as the second week of February, and then it was then followed by the crafting of the incident action plan by the team, and it was presented right after it was presented to the City Disaster Risk Reduction Management Council for approval. And then after that, in 2 weeks' time, we were able to come up with our own budget, even before the Bayanihan grant for cities and municipalities were given by the national government. So we all owe it to our mayor, city mayor, who was very decisive on the issue. It's easy to make incident action plans, any kind of plan, but I think what's important here are the decision makers, the mayors. In our case, the mayor has acted swiftly, so we didn't have any problems with activating everything. And I also agree with the presentation on the incident management team. It's a team of trained people. Here in Mati, we had the opportunity to be trained, sponsored by the World Food Program for 2 years. All sectoral representatives were trained from education, from the police, the fire, and the other sectors were trained on incident command system. That's why when we activated the incident command system, all of our mindset were directed into addressing emergencies. So everything followed. If we all visit the structure of the incident command system, it has a very good structure. It has the operations team, it has the administrative team, it has the logistics, the finance, and the information team. So all the incident commander has to do is to implement the incident action plan, and everything goes well. In the incident command system, as you can see in the earlier video shown to all of you, there was a partnership with the Catholic laity. Our alternate care site, the isolation unit of the city of Mati, is a partnership with the Catholic laity, with the Bishop of Mati, of Davao Oriental. They owned the lot and they lent us their lot, and the city just did the renovation of the property. We did the renovation in about 3 weeks during the lockdown. because we anticipated that we cannot manage our PUIs, our PUMs, if we don't have a credible isolation facility. So that was our priority. So in 3 weeks' time, we were able to set up our alternate care site, and then we also started training our contact tracing teams, and then we started engaging everybody, and then of course the incident command system uh, has also its own information officer. So what we did then in our communication strategy was to get on how to get our message across to the people, was to base it all on risk communication. Um, the process is that whenever we want something to tell the people, we would go into crafting a press brief, and then we review the press brief, and then we have it reviewed again by the mayor, and then we give it to the information officer. So makita natin, only one is distributing the information. So everything will be relayed down to the communities. The incident command system requires that policies or memorandums of agreements has to be made. So we had this memorandum of agreements with the Catholic laity, the other organizations, foundations that would like to help us on fighting COVID. So one example is a foundation. We call it the Halad Mission Group Foundation. It's a foundation by doctors and nurses, and the owner lent us his hotel to serve as shelter assistance for our workers from the facilities who will be needing quarantine when they finish their tour of duty. So again, I would like to reiterate that in times of crisis, in times of pandemic, I think the incident command system is the best approach. Now, for the second presentation on uh, transitory and medium-term consideration for planning, well, in this pandemic, our LGU initially planned for a 6 months war. However, we realized later that this would take around 2 years, so we made some adjustments. So our incident action plan has to be revised again based on the developments. And then the policies came. In the incident command system, we have the planning team, and we came up with a city ordinance. We call it City Ordinance 427. It was passed 1 month ago. The IRR already set, and including the citation tickets. We call it disiplina sa panahon ng pandemya. It's an ordinance that encourages the people to go minimum health standards. As we all know, 80 to 90% of the systems have been established by the government. The 10% will have to be uh, given by the people. Uh, it has to come from them. Their support is crucial to this war. Our contact tracing team has been expanded to around 100, and right now our contact tracing rate is around 100%. We are just using messenger chats, chat groups, ball pens and papers, but the training from the Department of Health is really valuable in helping us trace all the coming contacts. You have seen in our video our concerns, our problems. It's about surge capacity. Our facility can only accommodate so much, so we had to adjust. We had to hire or rent out facilities from the private sector, dormitories, to serve as quarantine facilities. And then we also encourage all our barangays to set up their own barangay isolation units. So that's how we address the surge in our communities. Alam naman natin maraming LSIs, locally stranded individuals, and returning overseas Filipino workers coming back to our cities, and we don't have any control on how many will be coming back. So we had to expand our health facility capacity. And the next thing that we should also consider, sana, is to expand our testing capacity. Right now, the City of Mati has a memorandum of agreement with the Davao Regional Medical Center based in Tagum, located in Tagum, as our testing facility. We do the swabbing here in our city, and then we send our specimens to Davao Regional Medical Center and Southern Philippine Medical Center in Davao City. So we have limited slots, but we make do with our facilities. So first, the systems has to be put in place. We isolate them, we identify, we detect, we isolate them, and then we schedule the testing for them. And if they turn out positive, they become confirmed cases, we do contact tracing. And then we quarantine the contacts. And then we schedule another tracing for the contacts. So that's the system. And then we reintegrate when they become well, or they are discharged from the facility, we reintegrate them. And we even crafted an anti-discrimination ordinance for that. Because in reality, when a patient goes out from the facility, he will feel alone when he comes home, and he will feel discriminated for some time until the community realizes that he's not infected anymore or infective anymore. So in adjusting, for the medium term, the city is now planning to do an emerging and re-emerging infectious disease ordinance. It's an encompassing ordinance that will deal mainly on strategic uh, response, preparedness, and prevention. So parang generic na ordinance suited for our city, considering our resources. And it has been our goal na never again we will be caught flat-footed when something like this happens. So October is our budget call, and the ordinance is nearly done. So our budget will be based on that ordinance. So the following year or years, we now have a prepared budget for that, focusing on prevention, response, and preparedness. And then on the last slide, and last presentation, uh, our communication goal in this pandemic, I believe, for us to win is to get our people involved. And communication has the biggest role in achieving that. And our communication strategy was based mainly on the information officer of our incident command. system or incident management team. He was able to set up an LGU website, an LGU web page, an FB page, and a Trimedia partnership. So he was effective in bringing our message across. He was also effective in putting in helplines for all our people, especially those with many concerns regarding COVID, to get their message to us. So the information officer sends the concerns to the different agencies for actions. And so here in our city, um, our goal is to save lives and save our livelihood. So on the presentation by Dr. Rayo, I agree that uh, the pandemic has taught us to look around. And when we looked around, we saw ourselves, our families, our environment, and our city. So our executive legislative agenda was focused on that area, on those areas. We need the pandemic taught us to go back, so we are aiming to boost to boost our economy, bring our economy back by using whatever resources that we have. So we go agriculture, we go establishing a fish port, a solar-powered fish port, facilitated by our mayor, and then we go set up a dressing plant, poultry dressing plant, and then we also manage, as what was mentioned before, that about the informal sector. We had this marketing assistance to those um, growing vegetables. We set up a selling point for them, an area for them wherein they can sell it to the uh, market vendors. So we set up a marketing system for them. So, and also the mayor mentioned that we're going to start putting up a stimulus package. It's not that much, around 20 million for small, medium enterprise. So I think that's about all. The COVID war is not yet over, and we're still learning. And I would like to thank this opportunity again for being one of the discussants and reactants in this forum. Thank you.